Welcome back to We Are Austin. You know, kids are little humans, but if they get hurt, we can't treat them like adults. Dr. Hussaini from ARA specializes in giving children unique care, and so she's going to share more about that this morning. Thanks for being here.
Thanks for having me.
What is special about pediatric radiology at ARA?
Well, we have 8 pediatric radiologists out of more than 100 radiologists at ARA.
Yeah.
And these people went for additional training, took additional certifying exams. We have pediatric techs that are very well trained and qualified at doing children.
Right.
And then we have 3 sonographers that took additional registry in pediatric sonography aside from their regular qualifications. So that makes us a good team of, you know, certified and qualified people.
It definitely does, and I'm sure that makes parents rest easy. Knowing you guys are so specialized and you have all the training and education, so you know how to handle different situations. Why does this have to be different for kiddos versus adults?
So kids are different emotionally and physically, and when a child walks into a clinic, we want to make sure that they're comfortable, that they're happy, that they're having fun as much as we can in a medical environment with a sick child.
Right.
And so we try really hard to have a decor that helps them do all that and has, you know, tailors to both the kid and the family so everybody's happy and comfortable, and so we can get the imaging that we need very quickly and very fast, so before we lose that moment and
that magic moment when the kid is still happy there.
Right.
Yes,
right. And so we have a children's imaging center that's dedicated to doing that. We have pediatric radiologists there and pediatric sonographers and pediatric techs, and the decor is all child friendly, and we have lollipops.
So you really set the tone and culture that kids can feel comfortable.
Yes.
How does the actual radiology look different? So
the radiology is different because kids are very radiosensitive, and so more so than adults. So CT is a life-saving technology, and we love it in radiology and in pediatric radiology. But in children, what we try to do is get them imaged in different modalities where we can, when it's appropriate. And when we do that with ultrasound, MRI, plain films, and then when we do need a CT, because there are times that's the best way to look at a patient, then we try to make sure that they're comfortable, they're happy, so that we can get it in one go, not have to repeat images.
Times,
Right.
So let's actually look at a few cases.
Sure.
So tell us a bit about this. What are we seeing here?
So this is an appendix. It's a near and dear topic to my heart.
If you don't mind, scoot to your right just a little bit. There we go. Okay, keep going.
So this is an appendix, and it's a normal appendix. Now, the reason why it's near and dear to my heart is because once we get our sonographers trained, and it's multiple exams that they have to do to be able to find this little structure. So it says 3 millimeters over here, and that's how small it is when it's normal.
Yeah.
And so when we can find a completely normal, full appendix in a child that came into the ER with belly pain, because that's frequently what they come in with, then we can say, okay, well, the appendix is normal, the kid doesn't need a surgeon just yet.
Good,
and this is fine. We don't need a CT, we don't need radiation, and it's a really great thing because this will prevent radiation, this will prevent surgery, this will prevent other evaluation, and we can move on to what might other causes be of abdominal pain. Right. And so this requires a lot of training. The techs have to do this over and over and over again, and when we can find it, we go. It's a hallelujah moment.
Yes, I'm sure it is, and it's good to know. What about over here?
So this is an x-ray, and it's really awesome to have people have subspecialization, because when you have subspecialization, you train your eyes and your mind to look for specific causes. So children will frequently have unwitnessed trauma, and they can't tell you that they hurt themselves. They will come in limping, and that's a very common cause of musculoskeletal injuries. And so they will come in limping. Child cannot tell you because they're 1.5 years old, and parent has not seen it. They just know that the child is not bearing weight. So there's this little line that goes across the tibia, and you really have to train your eyes to say, okay, well, there's a fracture over there, and sometimes you have to prove it to people 2 weeks later. See, there's a white line over there. It really is a healing fracture. Sometimes we have this conversation where we're like, I think there's a fracture. Really, are you sure? No, I'm not sure, but let's look at it in 2 weeks.
Yes, exactly. And that's why I'm glad you're the expert. You guys have that training, because you know what to look for, and parents can just feel so confident to come to you guys. So how do they find you? What's the best way to get in touch?
So we go to the website, osrad.com, and then there's a number on the screen that we can call for appointments, and you can specifically request that you want to go to a children's imaging center, and they're very good about setting you up.
Thank you so much for all the info. That's extremely helpful.
Thank you for having me.
Still ahead, see why it's a must for